break, we are still talking about molar pregnancy. Just in case you've just joined us, it is a journey to motherhood. And in this show, we basically look at pregnancy-related issues. Before we broke off, Melissa was telling us a lot of things she went through as a mother who conceived, and then she discovered that she had molar pregnancy. We're going to hear from Doctor. He's going to give us his medical opinion as far as molar pregnancy is concerned. Thank you.
Hello mothers, this is Dr. Kenya, General Military Hospital, Horizon Medical Chambers. Nice to be with you today. Molar pregnancy, medically it's called hydatid form pregnancy. This hydatid molar pregnancy is an abnormal chromosomal, or what we call trophoblastic formation. You get pregnant, but there is cell imbalance in connection. Fertilization takes place. We know fertilization is when the sperm comes and meets the ova, and then you get a baby. But there is some imbalance. So at the end of the time, we shall get issues like cysts formation, issues like seeds formation, and the baby will end up having chromosomal imbalance. At the end of the time, you end with hydatid, or what you call a molar pregnancy. There is no heart in that pregnancy. Most of the major cause of trophoblastic pregnancy, or what we call hydatid form pregnancy, is from the ova and imbalance in sperm cells. These sperm cells will always pick one thing, the genetic makeup or the chromosome. So the moment you get chromosomal imbalance, you end up with a molar pregnancy. It is more of a tumor. In brief, it is more of a tumor. It's like a cancer. So we always have to look at it and know it is more of genetic and chromosomal imbalance. With the technology we have and advancement of all medication, people can easily detect. For example, you easily go to the hospital when you are pregnant, you want to know how many babies you have, at what age. So people always learn for the scan. So as early as possible, someone may detect that I'm getting a molar pregnancy, and the earlier, what you call the prognosis. When you come at early age, the prognosis is very fine, and the management will be so quick and fast. So by 1 to 3 months, someone may be knowing that I'm dealing with a molar pregnancy because of the advanced technology we have. When a mother gets a molar pregnancy, first of all, it's more of cancer, tumor. So you may go for chemotherapy or medication with to eradicate cancer cells. The risk that you have, it may happen. You may have it for another pregnancy. So it requires you to be set, prepared, and then you move. Second, it can even separate marriage. We may advise you to leave the man you've been with. Remember, you've introduced, you've made weddings, so we can tell you to separate if you need babies. So it can cause that risk. And lastly, you may end up losing your uterus. There are some areas we can go in, you cannot help but to take out the uterus. You lose the uterus. So those are some of the risks we can talk about. One, we can prevent it. How can we prevent it? For example, when we detect it, when you get pregnant, you go to the hospital, we do a checkup, we do scans, we do lab tests. There are some tests we do like the beta HCG, and then we eradicate with the medication. Two, for the treatment, it is two. There is medication, whereby we take orally, we give you drugs, and then we can go for surgery. Surgery, it depends on how old or the gestation age. You may come, for example, that one you're talking about, who even had a whole year. It comes and solidify. You make issues like an ant hill. So it is hard to go in and remove it. So it will require what we call partial management, because it has partial and complete molar pregnancy. So the complete one, always we do it in phases, gradually. So you can come, we work on you today, this week, we give you 10 days or 7 days, you come back, we'll take a half, like that. So the management always will depend. Is it a partial molar pregnancy or a complete? And the gestation age. But you have surgery, you have medication, and you can do evacuation. We have a challenge with most of the couples, especially on the side of us, the male. When you tell the mother that you come with the husband, we do some tests, the man think of HIV. So wherever you call them, they'll ask the mothers, aren't you okay? Haven't they done tests on you? So why do you want me? Others, they send their brothers. This is my brother, is my sibling, is my follower, so you go with him. So when the male paternal fails to cooperate and come in, always will cause problem. But when they come in, we take samples, especially such cases. That's the only problem. We have what we call recessive incompatibility. You find out that the mother has a different type of blood and the father has a different type of blood. That one can be helped. The same thing with molar pregnancy. When we find such complications in pregnancies, we call both paternals. We take samples from the man and the next pregnancy will survive. Indeed, molar pregnancy traumatizes. First of all, the content that gets out what we call the contraceptive content, it will always scare. 3, as I've said, it is related with the tumor or cancer. So when someone hears about the word called cancer, he thinks he will not survive. So cancers always depend on stages. So those ones are minor. For example, if you have fibroids, everyone knows fibroids. Fibroids are cancers, but they are manageable. Anything you have on your body that is not supposed to be on you, it is a cancer, but they are manageable. So don't fear to come to the hospital. Always get the professionals. We can eradicate you and have as many babies as you want.
I've learned, I've got it, and I've taken the message seriously. We are going to have another short break, and then when we return, we shall hear different stories from our mothers who could have also gone through the same experience. Please don't go away, stay with us. This show is sponsored by Madagascar Nursery School. We are located on Entebbe Road, Kawukuka Chindu Trading Center. You can reach us on those numbers running on the screen. Madagascar Nursery School, nurturing amazing children.